Prova. stopped yet, is it? You don't know.
Okay, okay, abbassa il volume. You need to lower the volume.
Okay, that's fine. Your presentation is here.
Okay, thank you. Maybe we can close the windows. Yeah. Okay. Good morning, everyone. Good afternoon already. So yesterday we had really infection diseases topic related to the treatment of multi-drug resistant bacteria, which is hot topic now. But today we will have a little bit different, lighter topic. So I will present our results regarding the essential oils and their potential use in infection diseases. I already introduced myself yesterday. For those who are here today for the first time, my name is Aleksandra Barac. I'm professor in infection diseases in University Clinical Center of Serbia, Faculty of Medicine, and also I'm a subspecialist in clinical pharmacology and medical mycology. I did the huge part of my career was dedicated to fungal infections, actually. Today I'm doing everything, so whole infection diseases, and I'm leading the department for the fever of unknown origin. But also my love and my, especially related to the research, is dedicated to the fungal infections. Why? Because fungal infections, although we don't think about them so often, they are very, very commonly present. So 300 million people worldwide suffer from fungal infections. 75 million women are suffering from recurrent vulvovaginal candidiasis, which is really a huge problem for every day for those women who are suffering. 200 million children have tinea capitis, and 25 million have a life-threatening infections, and most of them are relating to the immunocompromised patients. So this is just estimated, but the study says that it's even 10 times more than we have the results in official publications and at official websites. So at the first place, when we speak about fungal infections, of course, we speak about yeasts and molds. Yeasts, the leading yeast is Candida and Cryptococcus. And when we speak about molds, it's Aspergillus, Penicillium, Mucormycosis, and Fusarium, the most common. And the related problem when we speak about molds, today I will speak about molds. When we speak about respiratory fungal infections, the biggest problem are actually molds. In which population? In people immunocompromised, immunocompetent, but people with atopy, atopic people. Today, there is an estimation from a European Society for Allergology that 43% of whole population suffer from some type of respiratory inhalatory allergen, and part of them are dedicated of inhalatory molds. And this is typical checking list for inhalatory allergen. Here we often see in atopic people who are sensitive, hypersensitive to molds. We often see hypersensitivity to Aspergillus fumigatus and Alternaria alternata. I don't know who works in a lab here, but there is a difference in the spores. So one have microspore, other have a microspore. And it's very important because those with the smaller spores can cause lower part respiratory infections. So they can go down, down, down because they have 0.2 nanometer spores. But the bigger, like Alternaria, they are stopped usually in sinuses. And that's the reason why they usually cause fungal rhinosinusitis. And we say, okay, but we don't see them. We see them very often. They are present everywhere. They are present indoor and outdoor. So in this moment, can you imagine how many fungal spores we are breeding in every moment? So in this moment, we are breeding around 2,000 fungal spores per 1 meter. So it's really 1 square meter. So it's really a huge amount of fungal spore. Imagine to add hypersensitivity, atopic, asthmatic patient, and any other hypersensitivity related to IgE antibodies. So the huge possibility to develop allergic fungal disease. And also the fungi are present in the dust, and there are a lot of studies about this. And they are not leaving us alone even when we are sleeping. And this is one of our studies. We wanted to see, okay, is it really present in our environment? And these were the samples of 10 ladies from my previous lab, and we took suborodextrose agar, plates with suborodextrose agar, and we left it open for only 1 hour in our bedroom, and you can see the results. So they are definitely present everywhere around us. Mostly you can see it's Aspergillus, but also there is Aspergillus niger, very specific, black, and most of this is Aspergillus flavus and Aspergillus fumigatus. And as I said, fungi are not leaving us alone even when we are sleeping. And this is one of the studies which showed the presence of fungi in a pillow and a huge amount of fungal spores even there. It doesn't depend on the hygiene of the woman and the other people who are living in the house. It only depends on the air. There are some air filters today which are commonly used in hematology units, but also some of them are present for house use, but they are not really successful in those what they should do. But it's of course even better to have them than not to have them. So human exposure to fungal spores is not possible. So we can't isn't possible to avoid it. So we are exposure to them all the time, and they are trigger for development of respiratory tract diseases. And you can see here. So we concluded fungi spores are present in a huge amount in air. We are breathing them. So the entrance door are upper respiratory tract usually, so sinuses, nose and sinuses. And if a person is immunocompetent, then usually it stopped here, so at the stage of upper respiratory tract. And if we do any kind of the analysis, for example, lavage or swab or from the nostrils, we will find some fungi, but it means colonization, and it means those what the person breathed in. If the person is immunocompetent but with atopic, then it can go down and it can cause, together with asthma or any other allergic component, it can cause allergy, and it is allergic Aspergillus bronchopulmonary allergic bronchopulmonary aspergillosis related to the lower part, and allergic fungal rhinosinusitis related to the upper respiratory tract. What it means? It means there is no disease. Fungi didn't go further and didn't go systematic disease, but they cause inflammation of the mucosa. And in immunosuppressed and immunocompromised patients, it causes infection. It can be systemic infection related to for example, lung or nose or liver, and it can be also invasive fungal infection, which can be spread like a sepsis all over the body. Presence, as I said, of the fungi can be completely physiological, like colonization, and can be pathological. Uh, Colonization of nasal and sinus mucosa with fungi calls microbiome. So when we say microbiome, it means everything, bacteria, fungi, and parasites. But when we say microbiome, it's only related to the fungi. And also a pathogenical condition means fungi on mucosa, which leads to infection or allergy. Of course, it's not the same if the person just entered into the room, which has black spots on the wall. probably the person will not catch disease. But if person lives in such condition, it's really important, uh, especially for those who are predisposed to allergic diseases. And also how it goes. So this is mucosa, and aspergillus make adhesion to the mucosa, grows. There is germination and growth and goes down, and also it makes inflammation of mucosa, and that's the pathophysiological mechanism of development of the disease. Today I will not speak about antifungal therapy. I will speak about something else that we did, and I would like to show some of our results. Those are results with Professor Salvatore and his collaborators, and also with some of the studies from my PhD and post-PhD. Uh, and in the view of increased global antifungal resistance, I believe, and the results show that nature products could be a potential source of treatment, especially as they're natural, they're cheap, but the appropriate concentration should be evaluated because of cytotoxicity. It's not only easy, okay, I will put a few drops of essential oil into my nose and that's it. They have cytotoxicity, and it should be very much clinically and laboratory analyzed. And that's what we did. We started with many different essential oils. So what are actually essential oils? They are non-greasy nature extracts from aromatic plants obtained through distillation, extraction. And what can be essential oil? A lot of different things: fruit, flowers, leaves, stems, herbs, woody parts, seeds, and so on. So they have a high ability to penetrate skin and mucous membrane. What is their plus? So what is their special characteristic? Due to their lipophilicity of molecules and their low molecular weight. So that's the reason why they easily enters mucous membrane. And we already have a lot of products with natural components, for example, for chronic rhinosinusitis. But are they so effective or not? It really depends on the reason of the infection. And also it depends on the way of application. It's not the same if we take the pill and if we do a spray. It's completely different. And this is one of the studies we did and published. This is related to the Malassezia. I hope you know that Malassezia is yeast that makes white spots on the skin. And we did sampling from the patients with pityriasis versicolor, and we wanted to check Myrtus communis. I believe you know for the Myrtus communis. And we made an essential oil in appropriate concentration, and we check it, and we found it as very, very effective. So you can imagine patient with white spots which suffers every summer because of Malassezia, and usual shampoos and usual skincare against with antifungal products inside was not successful. So you can easily suggest to use some of these products with Myrtus communis, and it's very, very effective, and it's very easy to use. Also, we published the paper related to biofilms, and it was a polymicrobial biofilm composed of Pseudomonas and pathogenic fungi. Pseudomonas is, as I said yesterday, very bad bacteria, and it likes everything, and it likes to be sticky and to sticky on itself a lot of different things, also fungi. And we made in laboratory conditions, we made the polymicrobial biofilm and put Pseudomonas and a few different fungi and try to try to kill it with essential oil, and we found that especially citrus species were very, very effective. There is one very effective essential oil from Sardinia. Originally, it's Pompea, and it's very, very effective. And it was the first on our list regarding the minimum inhibitory concentration. And also grapefruit was very successful. Uh, Also, we checked inhibitory effect of thyme essential oil and cinnamon essential oil on Aspergillus flavus. And we did activity prediction model. And it was actually one of our first study on this. It was in 2015 actually, it was published. And then we saw that, okay, there is also a model that we can follow how it kills the spores, and also specialists from physics was there in our team. It was the leading author, and we found that there was a prediction model how you can predict how long it requires for cinnamon oil to kill Aspergillus flavus spores. So, and we compare it with the azoles, so antifungal group of the drug, and cinnamon oil did it more effectively even. And also, this is this in the same year published study, development of kinetic model for testing antifungal effect of Thymus vulgaris and cinnamon oil on Aspergillus flavus spores, and application for optimization of synergistic effect. And then we published more studies and did analyzed oils. In this study, we analyzed oils that contain lavanda, and we isolated from a dust some species of mostly Aspergillus, but also other spores, but especially Aspergillus, and Fusarium and Penicillium from dust sample for dust sampling. We used the air sampling and PCR methods, and we checked it for these lavanda essential oils, and we find that also we checked for a cytotoxic effect for human cells, and we found that it showed no cytotoxic effect at very low concentration. It was 0.03% to 0.01% different lavanda oil, but those concentration actually was very, very effective for killing fungi. So it means that there is a huge potential for industry for these lavanda oils. We worked on this fur, and also this is one of our studies. We analyze Thymus essential oil and the potential anti-leishmanial activity, and we prove that there is a potential of Thymus essential oil as a potential therapeutic drug, if I can say, or option for the treatment of leishmania, and it was done in laboratory conditions. Okay, I think I showed this one with the Malassezia, yes. And also there are a lot of different, I believe you know for Artemisia. Artemisia is present almost everywhere. So this is one study from China. China's authors are leaders in almost everything, a huge population, so a huge percent of them are working in the field of science, but they are very, very focused on the natural medicine, and there are a lot of projects and collaborations with different European universities and Chinese universities because they want to check a lot of different human cells and different species from other parts of the world to their agents. They really believe in the natural medicine, and with the reason, of course. And this is one of very good studies where they check antibacterial activity and mode of action of the Artemisia capillaris essential oils in respiratory tract infection causing pathogens. And sorry, they checked for most common species like pneumococcus, like methicillin resistant Staphylococcus aureus, Klebsiella, Haemophilus influenza, and they show that it was very, very effective, and they compare it with the two most common drug which are used for the treatment of the serious infections. Also, this is one of good studies where authors analyze eucalyptus species. So you can see the essential oils which are used for with the nebulizer for the home use. It's okay, it's for the freshness of the air, but it's not the same. So for the killing the microorganisms, we need appropriate concentration, and it leads us to the personalized medicine. So it means that okay, we are suspicious that patient has, for example, fungal rhinosinusitis or bacterial rhinosinusitis, and it is chronic. So we need to take a sample, lavage or surgery, if it's going to be surgery, from nostrils, from sinuses, from lung of that patient, and then to isolate the fungi that is the cause of the disease in that patient, and to check it to different essential oils, and then to find appropriate cytotoxic concentration and minimal inhibitory concentration for the most effective essential oil, and then to make spray for that patient. And that's what we did in my post PhD. And we found out that after 3 months of the use, we solved 72% of the cases of fungal rhinosinusitis, and it was as effective as use of antifungal drugs for 6 months. So you can imagine 3 months less of the treatment with the natural oil, treatment only with the local, comparing to the pills, which are drugs, antifungal drugs, which have potential nephron hepatotoxic activity. So there is a huge potential of these drugs, of these components. And this is a study about eucalyptus species, as I said. I wanted to mention because in our studies we checked, but we didn't publish about eucalyptus. And they did evaluation of their antibacterial, antifungal, and antiviral activities. And there are a lot of different, and they compare with reference antibiotics for the most common respiratory bacteria. And there are a lot of data, but they found that almost all checked essential oils were more or as effective as antibacterial drug for pseudomonas. We are speaking about respiratory diseases, so not sepsis, not systematic diseases. So Haemophilus influenza, Klebsiella, Pseudomonas, Staphylococcus, Streptococcus, three different species. So definitely there is a future, but the problem is, of course, with systematic use. It could be easily for the skin use, but it's not easy to make pills and to make it efficient to kill bacteria which, for example, make sepsis. But maybe it will be the future. And this is one of those eucalyptus oils which show the best MIC, so bactericidal and inhibitory, with the best concentration. I mean, the lowest concentration. And also they tested some skin species like Microsporium, Trichophyton, and it showed also very good efficiency. And as I said, it's very important to see if it's killing fungi, but also to check if those concentration, which is killing fungi, does not kill human cells. So it calls cytotoxicity effect, and we always have to check cytotoxicity. We can't say, okay, this is effective, push that for the human use. We have to check is that concentration appropriate for the human cells. And this is also one of the studies which compare myrto essential oil from the myrto herb. It's study from Germany, and they compare it with the placebo. and it showed anti-inflammatory effect in a patient with a chronic rhinosinusitis. So imagine the patient with the chronic rhinosinusitis who suffer from the sniffing, from the inflamed sinuses during whole year, and use a lot of nasal drops, and at the end it destroyed the mucosa completely. But if they use essential oil, it has anti-inflammatory effect, the proven in this study, antimicrobial effect. It accelerates even the recovery of damaged mucosa. It prevents fewer development of respiratory diseases, low toxicity, low inhibitory and fungal and bactericid concentration. And also, this is one more study coming from United Kingdom, which systematically review herbal medicine for the treatment of rhinosinusitis. And there are a lot of studies, but what I wanted to show you here, this Sinopret is in a one of those. So we speak about experiments, but one of those came to final industry use. So you can find in a pharmacies Sinopret, in tablets, and even in a spray. It's combination of some of these herbs, and you can see that they compare it with different drugs and with different placebos, and they found that it was as effective as used drug, and of course more effective than placebo. Uh, and this is also one of the products they analyze, and it also can be found in the pharmacies. It comes from ananas, so it's extra from the ananas, bromelain, and they prove that there is no inferiority of this drug, of this extract, in a use in a patient with a chronic rhinosinusitis, comparing to the most common antibiotics and like a standard medication, and of course it's superior comparing to placebo. And this is bromelain comes from ananas. And also this very good systematic review analyzed myrtle, and it found that in a use for 14 days, it solved the symptoms of chronic sinusitis, and they compare it with placebo. Of course, it's more efficiency when when the study is compared also with the common drug regimen like antibiotics. Then you can see, okay, this is doing a thing, non-inferiority to the regular antibiotics, but it depends on the study, of course. And this is myrtle oil, and this is the product, of course, coming from China, and they made it for the public use. There, as I said, you can see there is echinacea. So echinacea, all of you know for echinacea, but it's also started like the small extract and the analysis on different bacteria and different human cells. Echinacea is more pushed for the immune system, so it means for the building, for the growing, for the improvement of the immune system, but it also has potential. In vitro and in vivo studies show that it has also antimicrobial effect, and bromelain, as I already mentioned. So they concluded that any herbal medicine are beneficial in the treatment of rhinosinusitis, particularly in chronic rhinosinusitis. It is limited, but there is evidence. It is not inferior, but there is evidence that Sinopret and bromelain coming from ananas may be effective in chronic rhinosinusitis. And this is what we did in our study. Sorry, this is the only slide on Serbian, but it's not important. I will explain. So we had two phases of the study. In the first phases, we selected the patients with the chronic rhinosinusitis based on the all criteria of European Respiratory Society, and we selected 136 patients. We did clinical examination, so ENT, allergology, skin test, specific IG antibodies. We took social epidemiological analysis, and we made a special questionnaire for these patients. And for the second phase of the study, we did a CT scan of paranasal part. Why? Because we want to see where is the focus of infection. Why? Because I did aspiration of the sinuses. So I put a small catheter and took the sample from their sinuses, and I brought it to the lab and analyzed it for bacteria, for fungi. Uh, and also we invent a new methods of sample processing. Why? Because we want to broken these sulfide bones, which usually fungi made with human cells. Why? Because we want to extract it and to make it grow on the media, on the medium, on the fungi medium. And also what we did, we compare, we give a plate with a saborodextrose agar to that patients, and we ask them to leave it open for 1 hour in their in their bedroom, sorry, and we compare the samples from the nose and sinuses with their samples. And also when we got the results, so it means that this patient has this fungi, this patient does not have any fungi, this and so on. So we selected the patients with fungal rhinosinusitis, and we analyze, it's what I taught as a personalized medicine. We analyze each sample of fungi to different essential oils in appropriate concentration, and we found fungal rhinosinusitis in these patients in 25. So it means 1/4 of all patients with chronic rhinosinusitis actually have fungal rhinosinusitis. Why? Because patients with chronic rhinosinusitis have inflamed mucosa and they're exposed to spores all the time, and at least 1/4 of them will develop fungal rhinosinusitis. And we isolated 35 fungal strains, the most common, of course, Aspergillus and Penicillium. And we did analysis for the myrtus, and the myrtus inhibited fungal growth in almost 100%. So, wow, it's a huge. And also we analyzed them for the regular antifungal drugs, and we didn't expect, but 65% were resistant to azoles, sorry, no, fluconazole, voriconazole. There is a mistake of voriconazole resistant strains. 65% of voriconazole strains were sensitive to myrtus. So it means it's even superior to antifungal drug. And the lowest inhibitory and fungicidal concentration was 31.25 and 125 micrograms per milliliter, and it showed low cytotoxicity. And what is Myrtus communis made of? Here are all components. And what we done after that, what we did, we we bought an empty sterile sprays like bottles for the sprays, and then fill them with myrtus in appropriate concentration and ask patients to use them for the 3 months. And as I said, they solved the symptoms in 92% for in all group that who accepted to do that, and they solved the problem with fungal rhinosinusitis in 3 months course. So it's very important final outcome. But we didn't make the sprays for the broader use. It was just for the study, maybe in the future. And we concluded that Myrtus communis is an effective preventive agent for fungal rhinosinusitis development and as a treatment as well. And that intranasal application in the form of a spray would reduce the number of fungi colonize the mucosa. And it's not only to prevent fungal rhinosinusitis, it prevents the further spreading to the lower respiratory tract, to the fungal, to pulmonary aspergillosis. essential oils are cheap and they have proven broad spectrum antifungal activity, and they're really potential candidates for topical use in respiratory tract diseases, and they are alternative to antifungals, which are nephro and hepatotoxic. From an ecological and economical perspective, as I said, they are cheap, and also they can be used in the patients with chronic rhinosinusitis as a prevention. So not only as a treatment because it's cheap, and they have a lot of advantages over antifungal therapy. But of course, big clinical studies should be done, maybe in collaboration with Chinese, to like prospective studies with a 6 or even 12-month follow-up to investigate in vivo effects of essential oils. And that's all what I want to say about essential oils. If you have any questions, please. I prefer it as well. I didn't show the Pomta because we didn't publish it, but Pomta was the first one. Pomta, grapefruit, eucalyptus, myrtos, they were all cinnamon. Yes, we did. Yes, we did. We did in a proper consultation. We checked. Sterile solution of natrium chloride. How do you say? Physiologic solution. Physiologic solution, but yes, and to keep it, yes, and to keep it in fridge and to every time to spray it, and we suggested spray it twice. Conservants? No, just to and it has very nice smell, so it was easy for them to use. So it was like a really personalized menu because the patients really like it. So we isolate the strain and they make their personal spray, with different spray for different patients. It's very effective. Um, when it comes to the industry and to pharmacy, there will be only one probably concentration for all. Yeah. So when you buy, for example, this one that you can use for the chronic rhinitis, but it was also very good and effective. This one, Sinupret Forte, you can buy it, but it's a combination of only one concentration. So it's not personalized, but it's possible to buy in a pharmacy. But I prefer personalized medicine because it's not a huge amount of patients. There are, for example, 36 patients, so it's easy to prepare for them. So maybe also in the future pharmacies can do that. So we do prescription and they can make it. So maybe it can be the future. On the other side, follow up on my yesterday's presentation. So antimicrobial resistance is growing up. So maybe really this is the future. Yes. In patients? No any. No any. Some say that it's strong when they inhalated it, but nothing. I mean, no any allergies, no any other side effects. And we checked their blood analysis because the other group of patients use voriconazole, and we compared them, and that's why we checked liver enzymes during this period for both groups, and there were no any biochemical results that were below or upper the reference range. No, no yet. Usually it's related to the skin and also related to the molds, but it's very good. Yeah, it could be for the future. Thank you. But thank you very much.
And I'm glad you came back.
Thank you. I always get more we will Yes.
Questo